Overdoses are on the rise in Lexington.
And health leaders are trying to figure out why. WKYT's Lucy Bryson spoke with health leaders about preventing fatal overdoses. She has our top story.
In less than 1 week, 24 non-deadly overdoses were reported in Lexington alone. The health department says you can help just by walking through their doors.
We really need to make sure that the public is aware of how to protect themselves and how to protect the ones that they love.
The health department gets a weekly alert regarding how many overdoses have happened in the week. Typically, they see 10 to 15. This week, they saw 24 from just September 17th to the 20th alone.
That's very concerning and highlights the importance of us having naloxone and being able to get that out to the community for free.
John Moses is the department's harm reduction services leader. He teaches a 10 to 15-minute class on how to administer naloxone kits.
It's simple. You take it out, you place the nozzle up in the person's nose, you press the button all the way in until it clicks, and it releases.
And there's actually 2 sprays in here.
First responders respond to these calls, knowing the severity of the situation. What's it like to respond to one of these calls?
It's generally chaotic. There's friends and families there that are absolutely scared to death.
Captain Seth Lockard says while it is hard to see, they always want that call.
We hope to respond to every overdose in Fayette County. We make sure that our crews are appropriately stocked. They have the Narcan. We also do Narcan leave behind from our ambulances.
And if you want to have a kit on hand, you can get them from the health department on Mondays, Wednesdays, and Thursdays. In Lexington, I'm Lucy Bryson, WKYT.
The health department has an overdose outreach team that can follow up with victims. At this point, health department leaders aren't sure what led to last week's spike.